Welcome to the LDN radio show, brought to you by the LDN Research Trust. I'm your host, Linda Elseygood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. This show is sponsored by Mark Drugs, who specialise in the custom compounding of medications, assuring that the client gets the proper prescriptions for their unique needs and conditions. They work with practitioners, integrating knowledge and treatment of experts to create comprehensive health plans. Visit markdrugs.com or call Roselle 630 529 3400 or Deerfield 847 419 9898. Today our guest is Dr. Laura Blevins, who's from Portland in Oregon, and she's a naturopathic doctor. Thank you for joining us today, Laura.
Absolutely, it's a pleasure.
So, can you tell us, when did you first hear about LDN?
I believe it actually harkens back to my first year in medical school. One of my professors who teaches the gastroenterology classes was a very big proponent of low-dose naltrexone and introduced us to it pretty early in some of our pathology classes.
That's interesting, isn't it?
It's
so different to Western medicine.
It is. Well, and my ears specifically perked up when he mentioned it because he was bringing it about in the context of autoimmune disease. And my father has had multiple sclerosis since the mid-1970s. So that was kind of something that was close to home.
Mm-hmm. And from a personal point of view, I have MS too. Did you get your father started on LDN? Has he tried it?
Well, interesting story. So my father was still down in Utah. I'm actually from Utah. I just lived in Portland for medical school. Mm-hmm. And he had seen the same neurologist for 30 years growing up, and we had to travel because we lived in a very small town. And I actually called his neurologist and spoke with him personally after I had learned about LDN and asked his neurologist if he was willing to prescribe it. And at first, when I said naltrexone, he somehow misheard me and thought I was saying methotrexate. And he said, "Oh, yeah, sure." But then we started talking a little more, and I realized he had misunderstood me, and he thought I was talking about methotrexate. He was more than happy to prescribe methotrexate for my father. But when I explained the low-dose naltrexone, he said, "Oh, no, I'm not going to try anything that's not tried and true for my patients." Mm-hmm. So he declined. However, I had heard about another naturopathic doctor who was practicing in Portland who kind of focused on autoimmune disease. So I ended up flying my father up to see her the following summer, and she started him on it. And we, in the context of many other therapies and things we were doing with him, it seemed to help.
Mm-hmm. Oh, good. That's good. Wow. So when you first started in practice, was LDN one of the tools you used for patients?
Oh, absolutely. I tell my patients all the time because I don't prescribe a lot of drugs, but when I tell them initially about LDN, I say this is the most common prescription that I write. It's something that I actually use personally as well. I have Hashimoto's, and I largely credit LDN with helping to get my Hashimoto's into remission. And I probably write at least a dozen prescriptions for it a week because I see so frequent autoimmune disease in my practice.
Mm-hmm. And when you start patients on LDN, what kind of a dose do you normally start them on?
So most patients, I will start with 1.5 milligrams at bedtime for a week, and then we double it to 3 milligrams for a week, and then we go up to 4.5 milligrams. And as long as they tolerate that, that's the dose that we stay at. And I do, I kind of give them a heads up that some of the more common side effects include restlessness and vivid dreams, and that usually those effects are tolerable and kind of fade the longer you're on the medication. But I let them know, with each dose increase, that if they start to experience those side effects and that if it's at a level that it's bothersome to them, that they need to call or send me a message and check in so that we can discuss options. Because I have a few patients that are very, very sensitive and need to stay at that lower dose and still get good benefits from it, but they can't tolerate the higher dosages.
Mm-hmm. And has anybody ever reported any negative side effects other than what is standard?
No, those are the two primary. Well, actually, no, I'll take that back. I had one patient who took it and just got horrible nausea. And it turns out after I kind of queried her further that she had had a very, very bad reaction to narcotics in the past. And so my theory is that it's some cross-reactivity with that narcotic sensitivity. And she ended up not being able to tolerate it at all at any dose. We tried even, a half of a milligram, and she got just overwhelming nausea, couldn't eat, and it was interfering with her life too much. But she's, one out of several hundred patients that I have on it that have had that kind of a reaction.
And do you normally prescribe, capsules or liquid?
Mm-hmm. I usually do capsules from our compounding pharmacy that's not too far. They have to ship it to my patients because we don't have one locally. However, I actually have used it with a few children, and I will do a liquid dose for the children.
Mm-hmm. And could you tell us about prescribing LDN for children? How do you find the right dose?
Absolutely. So the children I've used it for, the youngest was age 6 and was very, well developed for her age. And actually, we were using it for her for severe allergies that had been pretty resistant to any other treatments. And I started her with a 1/4 milligram, and then we ended up moving up to a 1/2 milligram, then to 3/4 of a milligram, and she ended up staying at a milligram. And we did 6 months worth of therapy and then tapered her off of it. And remarkably, so far, and we're about 1.5 years out now, her allergies are completely gone and have not come back.
Oh, wow.
I know. She's kind of one of my miracle cases. Her parents were so desperate to try anything because she had done allergy shots and was on, high-dose anti-allergy medications every day that made her very drowsy and less functional in her life. And they were so happy that we found this other answer for her. Well,
for the child herself, she must feel as though she's, in brackets, normal. Because to feel drugged up is terrible, isn't it? And especially when you're a child and you want to run around and play, and you have to learn so much in school at that age. So, that is amazing. And have you had any autistic children on LDN?
I have tried one on it. Unfortunately, he has now lost a follow-up. His family moved back to the Midwest, and we had started him on it just at a 1/2 of a milligram, and I saw him for about 3 months. And it seemed to be helping. His behavior had kind of moderated. Of course, as a naturopath, I'm working with lots of different therapies all at once. So it's hard to know for sure how much the LDN by itself was helping. But he seemed to be gradually improving. And I'm hoping that wherever they ended up, that they were able to continue that therapy.
Yes. And some people are under the impression that LDN is a miracle drug or a cure, and it's one pill that fixes all. And you... and you don't have to take anything else, but you have to work at it. It's not a magic bullet. Would you like to speak to your daughter?
Oh, yeah, actually, I'm going to go hand her off to a sitter I've got who just showed up. So.
Okay. So as I was saying, it's not the magic pill that's going to fix everything. If you have gut issues, they've still got to be sorted out. If you have sensitivity to food, you need to sort that out. Exercise is really important. Even if you are wheelchair bound, there are still some exercises you could do.
Absolutely. Oh, sorry. She just discovered that I had... Oh, you're okay. Okay. I'm just going to hold her for a minute.
Okay.
I'll bring you back out in a minute. I always counsel my patients about kind of what I call the basic treatment guidelines, and exercise, good, clean diet, stress management, good sleep. Those are all part of those foundations that I work on with every patient. Make sure that those are really solidly in place. And then, of course, going for any specifics for them, like you said, food intolerances tend to be a big one. I do a lot of food allergy testing in my practice, or counsel patients on how to do elimination diets and the like.
Mm-hmm. So how do you advise your patients to get a good quality of sleep? What is the key to a good night's sleep?
Oh, that's the magic answer, right? Well, I talk with them a lot about sleep hygiene, about having, a good bedtime routine that generally does not include any kind of screens. I talk with them about how screens inhibit our natural melatonin production, and, usually counsel them to, read a good book before bed, but not anything too exciting. And especially if they have issues with insomnia, I generally recommend that they read something on the drier side, reading the dictionary or an old college textbook or something that was very dry and put them to sleep, when they were in school. Often we'll put them to sleep now as well. And then, trying to keep a regular schedule, getting to bed at a decent hour, preferably earlier than, 11 o'clock midnight, which a lot of us are prone to pushing ourselves towards. And then making sure that they get a good night's sleep, oftentimes employing things like white noise machines, because a lot of people tend to be very light sleepers and wake up frequently to small things. And sometimes as simple as just running an old fan in their bedroom will dramatically improve the quality of their sleep.
Oh, didn't realize that. And what about supplements? How do you find out what is the correct supplements for a patient?
Well, it depends on what they're being treated for. I generally, again, kind of back to my basic treatment guidelines, I have 4 basic supplements that I recommend for most patients, and that's fish oil, probiotics, magnesium, and B vitamins, just because those tend to be very common things that patients need. We generally eat more of a omega-6 or pro-inflammatory diet. And so having the fish oil to kind of balance that out with the omega-3s, the anti-inflammatory effect, is usually something that most people can benefit from. Most people have some level of joint pain or inflammation or, eat too much sugar in their diet. And so that can help kind of balance that ratio out. And then, of course, probiotics to kind of help keep the gut happy and keep things balanced. Magnesium, I tell people our best sources for magnesium often are those dark leafy greens that most of us don't eat every day, even though we probably should. But especially in the wintertime, a lot of people are not so inclined to eating big, kale salads or anything like that. So I find magnesium is a common deficiency that most people can benefit from, a little extra magnesium, especially in the evenings, and part of that kind of bedtime routine to help them wind down and ground them out. And it's a natural muscle relaxer, so people really enjoy taking that before bed. And then the B vitamins, just because so many people are not getting adequate levels of real B vitamins through their food. Oftentimes they're eating, processed foods that have been stripped of their natural vitamins that have then been, supplemented back in with the synthetic variety. And oftentimes those are not well tolerated. There's the idea about the MTHFR genes, which is a whole nother discussion in and of itself. But I generally recommend people take, either a B complex or a good quality multi that has all the B vitamins in their, natural methylated form so that they can get as much benefit as possible. Because I meet very few patients who don't desire some, improvement to their energy and their brain function. And B vitamins are so good for both of those. Mm-hmm. And then depending on what their condition is, we'll recommend other supplements depending on what is indicated.
Just as a side issue that I was thinking about food and supplements, mm-hmm. and as you were saying, that our food doesn't necessarily have all the goodness in it that it would have had years ago with processed mm-hmm. foods. If we skip forward like 100 years, and as the population grows, especially in England, we can't support ourselves food-wise. We have mm-hmm. to import a lot of food. Could you see that we would have our food, like a science fiction tablets or something, where we wouldn't be having food as we're having it today? Do you think that could happen in the future? I can see where that could maybe be a possibility, but I really feel like most people enjoy food. They enjoy the eating process, they enjoy the cooking process, and having, those smells permeate through their nasal passages. And I just don't see us ever as a species completely moving away from that. I definitely have a few patients that say, I just eat to live. But the majority of my patients really seem to enjoy food. And I put myself in that category. I love to cook and to experiment with new recipes. So I don't think we'll ever be at the George Orwell state where we're just taking a pill 3 times a day for our food. It was just making me wonder, because we're having to supplement what really mm-hmm. we should be getting from the food.
Exactly. And I talk with my patients a lot about that, because a lot of them say, oh, well, I eat a really healthy diet, and so why do I need to take all this? And I say, well, 200 years ago, you might not have needed to take it. But unfortunately now, especially with big agriculture, the farming practices are not sustainable for quality soil. And so a lot of those nutrients that would have come through the food are no longer there simply because they're not there in the soil.
Yes. And I have quite a few people who want to lose weight, and they'll tell me, I'm on a gluten-free, dairy-free diet. I don't eat sugar and I don't have bread or potatoes, yet my weight is still high. But portion control is very important, isn't it? I mean, you can't still eat from morning till night healthy food. There is still a limit of how much you should be eating.
Oh, absolutely. Yeah, we talk a lot about portion size. And interestingly, I don't know if you've come across this yet, but naltrexone is now being put in a combination pill with bupropion, or Wellbutrin is the trade name, and given as a twice-a-day 8-milligram dose for appetite suppression. And I've actually noticed that I've talked with a few patients that, weight loss was one of their goals, and we were starting LDN usually for other reasons. I said, you might notice that you have some decreased appetite once you start this. And they do. Several patients have noted to me that they find they're easier able to regulate their portion size and that they're not, still hungry after their meal. So kind of an interesting side effect from it.
Well, certainly a plus point, isn't it? Definitely.
Yeah, absolutely.
So the length of time that you've been prescribing LDN, and you said that you've been taking it yourself, do you have any case studies that, spring to mind that you'd like to share with us?
Well, the 6-year-old with allergies was an interesting one. I'm glad that we already got to that one. Let's see. Yeah, I have a patient who came to me several years ago with ulcerative colitis that was just terribly controlled. She did not tolerate conventional treatments. She had been on, steroids and methotrexate and had horrible side effects from those. And I talked with her a lot about diet. We started the specific carbohydrate diet because that's a common one that I recommend for ulcerative colitis or Crohn's. And we started her on LDN. And she, within a month, with her ulcerative colitis was in complete remission. And she was just blown away. And we didn't know whether, it was the diet, whether it was LDN. Of course, I had her on a couple other of those basic treatments. And so at one point, probably about a year ago, she ran out of LDN and she hadn't come to see me for some time. And within days, her ulcerative colitis flared right back up again. Oh, wow. And so she came to see me and said, I didn't realize how much this was helping. And so, we immediately got her back on it, and it's back into remission, and she's feeling great.
That's amazing, isn't it?
It is.
And what about your Hashimoto's? How did you start on LDN?
So, obviously it's something that is commonly prescribed for all autoimmune disease, but I had heard while I was going through school of quite a few patients with Hashimoto's that were put on LDN. And I'd actually requested it of my physician while I was in school, but I was in the process of trying to have a second child, and she didn't feel comfortable prescribing it knowing that I was trying to get pregnant. Although, hindsight and further research I have found actually shows sometimes it can be beneficial for fertility. But at any rate, it was always in the back of my mind. And so after I had my second child, I spoke with my provider, and she was very kind of holistic in her approach, even though she was a conventionally trained medical provider. And she was willing to prescribe it, and we started on it. And during my pregnancy, and during both of my pregnancies, my Hashimoto's had gone into remission. My antibodies were negative. But then as soon as the pregnancy was over, my antibodies had always come back up. And even though I was doing everything else dietary and, everything else right, those antibodies were quite high. And I would feel pretty fatigued and, have all the symptoms of thyroid, even if my thyroid hormones looked good, on labs. And we started it and retested my antibodies about 6 months later, and they were completely negative and have maintained being negative, and that's the first time in over a decade outside of pregnancy that my Hashimoto's has been in full remission. So I credit it entirely to LDN.
Wow. That is an amazing story there. When patients come to you who are on an opiate pain medication, what is your approach? What do you do?
So especially if they have a condition that is inflammatory, I talk with them a lot about how, the research actually shows that opiates can sensitize the brain to pain and over time become less effective and can actually make their pain seem worse. And so that's always an end goal, is trying to get them off of their narcotics. And I talk with them about LDN and say, once we can get you off the narcotics, there's this other answer that can be very, very helpful at helping to decrease your inflammation, make you feel better by, increasing your endorphin levels, and can help to moderate their pain. And so I usually taper them down very slowly, give them lots of other kind of anti-inflammatories, curcumin and, quercetin and some of the kind of good natural anti-inflammatories. And once they can make it completely off of their narcotics for 24 hours, then I usually actually have them start right off at 4.5 milligrams. And I actually have them start at 4.5 milligrams of LDN twice a day for the first couple of months. Oftentimes I find that helps dramatically with some of their withdrawal symptoms from coming off of the narcotics. They don't get as severe of diarrhea. They have less, nausea and sweating and all those kind of common narcotic withdrawal symptoms. And so we do that, like I said, for usually 3 to 6 months, and then I try and move them down to just the once-a-day dosing. And most of them do very, very well. And oftentimes it depends on how long they've been on narcotic. If they've been on it for 20 years, and they say sometimes we need to do that twice-a-day dosing a little bit longer. So we kind of tailor that to them. But that seems to work very, very well for them.
Well, that's interesting, because I have only heard of double dosing before with people with chronic fatigue syndrome, where they've found having it twice a day gives them the buzz, the uplift, it helps with the fatigue. But with pain, that's the first time I've heard of that. So that's really interesting. And normally people work their way up, but you go straight in 4.5 twice a day?
Wow. I do, because I feel like blocking those opiate receptors at that high of a level right away really helps them to be successful with staying off of their narcotic.
Wow. And you said only a 24-hour gap before they start. Oh, that's really, really good. Okay, I was just getting it in my head. And you say no side the withdrawals. They much
less. Yeah, usually people will go for several weeks with having, really horrible diarrhea and the shakes and sweating and just feeling awful and feeling very depressed. And the ones that I've been able to get on to LDN quickly do just so much better. They report way less side effects, and they're far more functional more quickly.
Wow, that's really good. Okay, so put myself off what I was going to say now. So when they go back, if they find after 3 to 6 months that dropping it down to one a day, and sometimes you said they have to go back on twice a day, is it because they start to have diarrhea or the shaking and sweating again? Or
no, their pain is just increased.
Oh, okay.
Yeah.
Oh, right. So taking it twice a day actually, apart from everything else, all the other withdrawal things, it actually helps with the pain twice a day.
It does, yeah. And my understanding, what I explained to them is it's mostly through the endorphin modulation, that taking it, naturally increases our body's production of our endogenous endorphins, which are, our pain modulating hormones. I say, endorphins are what get women through childbirth naturally. And if they can get them through childbirth naturally, it can help you, with your chronic pain from your, herniated disc or old injury or whatever their cause of pain is.
Well, that's really good, isn't it?
Especially, I don't know if you guys are experiencing this in Britain, but of course in the United States, we're in a kind of an opiate crisis. And so it's harder and harder for patients to find anybody who will keep them on narcotics long term, which I think is a good move. But unfortunately, they're not being presented with a lot of other alternatives. And so a lot of them come to me saying, my physician says I can't be on this anymore, but they're not telling me anything else other than, high dose Tylenol or ibuprofen. And of course, those have some pretty hefty side effects to them that can be very damaging to some of our essential organs. And so they oftentimes balk at those recommendations. And like I said, I'll often give them other anti-inflammatory herbs along with the LDN that help to keep their inflammation low while we're working on, getting their movement going and trying to get them more functional. And most of them do very, very well. I've had a couple that were lost to follow-up that I'm sure probably ended up back on narcotics, and it's unfortunate, but it is what it is. I'm just happy to at least be able to offer them an alternative that works pretty consistently.
Mm-hmm. And what about anxiety and depression? I know there have been quite a few people that have contacted me where they've not been able to get their medication that they'd been on for the last 30 years. I think it's a similar thing as to the painkillers. And many
the benzodiazepines are a big one that's being.
Yes.
There's a lot of hesitancy now to prescribe those medications.
But it's difficult for the people that are addicted to them to suddenly not to be able to get them and not to be given the support, so it would seem to me. But LDN does seem to work in those cases as well. Have you any experience of that?
I haven't prescribed it as much specifically for those indications. Usually I'll tell my patients, especially if they have, chronic pain and depression, that I say this is going to be kind of a double-edged sword for you, that it's going to be helpful for the anxiety and depression, and it's also going to be helpful for the pain. And they do. They generally feel better. And I notice, personally, my own mood is improved. If I go out of town and forget to take my LDN for a couple of days, I'll start feeling a little more irritable myself, and my family notices it too. So they definitely encourage me to stay on it for some of those reasons. But I haven't had as many people that I've put it on it specifically for that. I think, as a naturopathic physician, I have a lot of other tools in my toolkit that I use for anxiety specifically and depression. Oftentimes, herbal things, or trying to do some genetic testing, kind of back to that MTHFR genetic pathway. And oftentimes that's a major factor. And once we can kind of get them sorted out with their neurotransmitters and, being on appropriate levels of the B vitamins, their anxiety and depression can, improve dramatically.
Have you noticed, being on LDN, that your desire to drink alcohol isn't as great as before? I'm not saying
I've read
you had a drink problem.
No, of course. No, I've read that recent research talking about how LDN can decrease alcohol cravings. I've never been much of a drinker. I'll enjoy an occasional glass of wine with dinner. So I haven't noticed anything real personally, but I've had a few of my patients that I was counseling on trying to do a Whole30 diet, which is no grains, no dairy, no sugar, and no alcohol for 30 days. And oftentimes there are people that I'm also putting on LDN for other reasons, because they have an autoimmune condition that I want them off of the grains for. And I tell them, I let them know that being on this medication will potentially help, because some of them are drinking, 3/4 to a full bottle of wine a night. And I say, that's too much. That's going to damage your liver. And so I'm not sure, again, I'm always working with multiple things at once, how much the LDN truly helps them, but most of them are successful at least doing that 30 days of absolutely no alcohol, and then trying to restart it at a much more moderate level.
Well, that's good. And any of our listeners out there, if they would like to have a consultation with you, how do they get hold of you?
So my contact information is all on my website, which is wholesomefamilymedicine.com, and it's wholesome, WHOLE, wholesome. And I'm in Southern Oregon, and they are more than welcome to contact me either through the website, or my phone number and everything is on there as well for my office. And I'm busy and booking out until May right now for new patients. So it's a bit of a wait, but most of my patients definitely appreciate my approach. And I'm unfortunately or fortunately, I'm the only one in my area that is doing more holistic kind of family practice or primary care. And so I think that's part of the demand level.
Oh, wow. Well, thank you so much for joining us today and sharing your experience with us.
Absolutely. Thank you so much for having me.
This show is sponsored by Mark Drugs, who specialise in the custom compounding of medications, assuring that the client gets the proper prescriptions for their unique needs and conditions. They work with practitioners, integrating knowledge and treatment of experts to create comprehensive health plans. Visit markdrugs.com or call Roselle 630-529-3400 or Deerfield 847-419-9898. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.